I am pleased to report that 11,923 Albertans have now recovered from COVID-19. We identified 108 new cases in the last 24 hours. 6 of those cases are at the Bright Horizons daycare and out-of-school care location. The daycare closed on August 20th. The infant and preschool room opened yesterday, August 26th, because it had no reported positive cases. And let me correct my previous statement. All 6 cases were not detected in the previous 24 hours. These are cases that have been detected over the past several weeks. We do continue to monitor the situation at Bright Horizons. Today, there are 1,158 active cases in the province. 49 people are in hospital, including 7 in intensive care. We completed 10,089 tests in the last 24 hours, bringing total tests to 922,397 so far, with 736,405 Albertans tested. I must report 2 new deaths, bringing the total number of people who have died from this virus to 237. Every one of them was a father, mother, son, daughter, or other loved one to families and friends. I offer my condolences to all who are grieving losses of any kind right now. With school opening next week, I know that concerns over the pandemic are adding to the usual back-to-school jitters. I hope that parents, teachers, school authority staff, and anyone who is concerned about school reopening has had a chance to look at the online toolkit by Alberta Education. It provides a parent guide in 7 languages on what you can do to prepare your child for the new school year. The toolkit also lets you read all the guidance documents that apply to schools, including school reentry, sports, and libraries. Those guidance documents are based on the best available science and on reviews of educational experience from around the world. They also provide the specific actions that all parties must take to keep students and staff safe and prevent spreading the virus in our schools. I also hope that parents, teachers, and anyone else with an interest in school reopening have had a chance to look at the resource guide for COVID-19 outbreaks in schools, which was released late last week. That guide sets out specific protocols should a school experience a single person with symptoms, a confirmed case, or multiple cases leading to an outbreak being declared. What is not specified in this document is what has to happen to trigger a school closure. This is intentional and meant to ensure that each situation gets a full assessment. Return to in-school learning is complex, and a number of factors will inform any school closure decision. Each situation will be different. For example, it is possible that a social event outside of school results in spread, and many students who attend a school are impacted, either as cases or close contacts. A school outbreak may be declared as a precaution during an investigation with this instance, but does not necessarily mean that the school environment is unsafe and should be closed. Conversely, in an investigation of a small number of cases in a school, it may happen that a large number of exposures are identified, and closure of that school may be warranted based on that particular situation. In order to ensure that all tools are available to public health and educational teams, as would be appropriate to the local context and situation, we are not predetermining specific triggers for school closure. We will be carefully monitoring the implementation of in-school learning in Alberta. This close monitoring will be used to detect any early signs of concerns that will inform ongoing evaluation of our public health advice and school reentry plan. I know this may cause concern for parents and teachers who might prefer a single number to watch for. I assure you that teams at AHS, Alberta Health, and Alberta Education will monitor the situation in schools very closely. We will be in frequent contact with school authorities and each other to exchange information. A student, teacher, or staff member who develops symptoms at home cannot go to school. Public health measures for schools include a screening questionnaire. Parents should go through the questionnaire every morning before school to determine if the child can go to school or needs to stay home. Students, teachers, or staff who develop symptoms at school must be immediately isolated and sent home as soon as possible. Anyone who is sick must stay home and away from others, and testing should be arranged through Alberta Health Services. I want to remind everyone that pharmacies can only test people who have no symptoms and no known exposure. If the person with symptoms tests positive for COVID, Alberta Health Services will identify and contact everyone who had close contact with that case, offer testing, and outline the isolation measures for those contacts. Only the close contacts of that particular case are required to isolate. Finally, I want to address the question about delays in accessing testing and completing notification and contact tracing. The teams at Alberta Health Services have been working tirelessly to decrease the wait times, to speed up transportation of samples and entry into the lab, and to increase capacity of our frontline teams to notify people of their results and complete contact tracing. This work is essential to get information on test results into people's hands as quickly as possible and to complete contact tracing to make sure that onward spread is minimized. One key development in making this information access better is an update to My Health Records that was completed this week. My Health Records is your portal to accessing your medical records, and it is the fastest, most convenient way for you to access your COVID-19 test results. Effective immediately, when you sign up for My Health Records for the first time, you will now be able to access test results as soon as they are entered into the system. This access will expire after 30 days if account verification is not completed. So please take the time to finish this step in order to keep your account available to you over the long term. Albertans over the age of 14 can sign up to My Health Records on their own and view their COVID-19 test results, as well as other common lab results, immunizations, medication history, and other personal health information.